Hi, Antonio. Nice to see you. How are you doing today?
Hi, I'm doing okay. Thanks for asking.
Great. Thank you for coming in today. I would like to take the next 10 minutes or so to talk with you about the recent assessment that you completed regarding substance use. I can assure you this information is confidential. Does that sound okay with you?
Yeah, sure.
Perfect. So, first and foremost, thank you for completing the assessment. I understand that it can be difficult, to be honest, when answering the questions, and it may feel a bit intrusive. However, your responses do help us best support you.
Okay.
Perfect. Do you have any questions so far?
No, not right now.
Okay, perfect. I would like to begin by sharing with you the results of the assessment. Is that okay with you?
Yes.
Perfect. The first category is tobacco use. You scored a 26 for tobacco, which is considered moderate risk. Moderate risk means that you are at risk of developing health and other problems from your current pattern of substance use. Some risk factors associated with the long term risks with use of tobacco include premature aging, respiratory infections, high blood pressure, and diabetes, heart disease, stroke, and certain cancers. Were you aware of the risk factors associated with the use of tobacco?
Some I always knew tobacco can cause lung cancer, but I was not aware of the other risk factors.
Yeah, you're absolutely right. Lung cancer can be a result of tobacco use. There are multiple risk factors associated with tobacco use. The second category is alcohol use. You scored a 37 for alcohol use, which is considered high risk. High risk means you're at higher risk to experience severe problems related to health, social, financial, or legal issues, for example. I wanted to share with you that currently, for your age as a male, you are drinking more than those at a low risk level. The low risk level for men under 65 is no more than 14 drinks a week and no more than four a day. And in this case, a drink is considered 12 ounces of beer, 5 ounces of wine, or 1 ounce and a half of distilled spirit. Regular excessive alcohol use is associated with hangovers, aggressive behavior, premature aging, anxiety, and depression, relationship difficulties, financial and work problems, difficulty remembering things, liver disease, cancers, and even suicide. For these reasons is that I'm concerned of the high risk related to alcohol use and would advise to begin to decrease use with a goal of ultimately stopping the consumption of alcohol. How do you feel about these results?
Um, it's scary to think about the numbers. I have been trying to avoid thinking about it and instead just hope that I can carry on and live healthy, but I am seeing how the use of substances are beginning to negatively affect my life. I was not expecting myself to be considered high risk for my consumption of alcohol or cannabis.
Yeah, true. And cannabis, that's a really good point. I'm glad you brought that up because that's our last category. It's cannabis use. And you scored a 34, which is also considered high risk. Regular use of cannabis can be related to problems with attention and motivation, anxiety, paranoia, panic and depression, decreased memory, and problem solving ability. Also, high blood pressure, asthma, bronchitis, heart disease, and um, chronic obstructive airways disease, and even cancers. For these reasons, I am also concerned of the high risk associated with your use of cannabis. How do these numbers make you feel?
Honestly, this is the first time I see how severe my use is. I never really thought it was a lot.
Yeah. This is why it's really good to get that perspective. And one way to support you with improving your health and well-being is by reducing or stopping the use of tobacco, alcohol, and cannabis use. What you do with this information is completely up to you. I am simply here to provide you with information and knowledge on the risks associated with your current pattern of use and fully support you with ways that we can decrease that use.
great.
Okay. So regarding the high scores with alcohol and cannabis, the high risk categories, how does that make you feel? What are your thoughts?
I honestly did not feel like I consumed enough to be considered high risk. I have been thinking about cutting back for a while, but I just never felt it was all that bad. So it's difficult because they do make me feel good and relaxed for the time being.
Okay. Fair enough. I hear that. I hear that. And can you tell me what are some good things about consuming alcohol and cannabis?
I like that I feel good. I'm able to feel good and just forget about all my worries and problems. I feel that I feel relaxed in that moment.
Okay. Now, can you tell me what are some of the not so good things about using these substances?
Yeah. I think I don't like the after effects. I get terrible migraines. I feel I have a low mood, and I feel depressed and anxious. I also don't like the effects that it has on my relationship. It usually leads to arguments. I have been feeling more irritable, so I also worry about the long-term effects that it may have on my health, because I am already beginning to feel more physical and mental symptoms.
Okay, I hear that. And what you are describing are risks directly associated with the long term use of these substances. And there is a connection between some of the feelings that you mentioned, such as feeling depressed and anxious with your high consumption of alcohol and cannabis. What concerns you the most about using substances?
Well, I want to live a healthy life, and I fear for my health. I keep hearing about the long-term effects like strokes, heart attacks, and all that scares me, honestly. So, although I don't think I use it enough to cause that much harm, it is scary.
Yeah, I can see how that can be very scary. What I'm hearing is that you are concerned about the negative health impact of using substances, as some people do get heart attacks and strokes from continuing use of frequent substances. You just feel like maybe you're not using as much as they are. But I also hear the other side that you are concerned about the risk factors associated with the continuous use of tobacco, cannabis, and alcohol.
Exactly. Yes.
Okay. And may I ask, on a scale of 0 to 10, how much do you want to make this change right now? Where 0 means not at all, and 10 means yes, I am ready to do the work and make some changes.
I would be
Okay.
an 8 out of 10.
And what led you to choose a specific number?
I'm tired of having low moods and having a failing relationship because of my use of alcohol, cannabis, and tobacco. I'm tired of it all.
I hear that. And what would it take for you to move to a higher number?
I think being informed and having the support of someone, either my therapist or friends, I want to feel supported.
Great. And to assist with support and helping you be informed, may I provide you with information that is factual and about how the continuous use of tobacco, cannabis, and alcohol can affect your health if there is no change to the current continuous use of substances?
Sure, thank you.
Great. So I will be providing you with that resource and other resources to support your knowledge around substance use and ways to reduce the habits. Again, thank you for coming in, and I look forward to speaking with you soon. Do you have any last questions or concerns?
No, thank you.
Okay, perfect. So I'll be seeing you next week. Thank you.
Okay, thanks.